Hello everyone, how's it going? Sometimes taking Tylenol only doesn't do the trick when it comes to fever and pain. That may make you wonder, could I alternate Tylenol and Advil? Well, if that sounds interesting to you, then keep watching. Now, just for simplicity, I'm going to refer to acetaminophen by the common brand name Tylenol in the United States, and I will refer to ibuprofen as Advil for the most part throughout the video. Now, it's rarely happened to me, but many years ago I had a cold or flu, and it gave me such a terrible sore throat. It hurt just to breathe. So I would take Tylenol, and before it was time for my next dosage, the pain would be so incredibly, I just couldn't take the pain anymore. So I actually had heard that you could alternate. You could take some Advil in between your Tylenol dose. So I wound up doing that. I'd take Tylenol, 3 hours later take Advil, and then 3 hours later I'd take Tylenol again. Well, recently I had a procedure and I took Tylenol, which I've been trying to do the last couple of years because it's easier on my stomach. I actually found out when doing some research why the ibuprofen irritates my stomach. But we'll talk about that a little bit later. Well, I took the Tylenol after the procedure and I pushed it all the way to 4 hours and I was really hurting. So I went ahead and took some Advil and it gave me some tremendous relief. But I started wondering if this was still safe. Is it still safe to alternate these two medications? Also, I wondered if it was safe to do with extra strength Tylenol or if it was only safe to do with regular strength Tylenol. Wondered if there were any risks or if this was really, how long would it be safe to do this for? So I did a little research, and according to the Cleveland Clinic, it's important that you don't take acetaminophen and ibuprofen at the same time. You can take one, and then 4 to 6 hours you could take the other, and that's really the more conservative approach. It's possible you may need to alternate the Tylenol and the Advil every 3 to 4 hours throughout the day if your fever and pain just aren't managed with the longer wait times. Now you can alternate the Advil with either regular strength Tylenol or extra strength Tylenol. The important thing is that you want to make sure you don't exceed the daily recommended amount, which for Tylenol is no more than 4,000 milligrams a day. But many experts actually recommend no more than 3,000 milligrams a day. Now when it comes to Advil, it's recommended not to take more than 1,200 milligrams per day if you're self-treating. If you have a child under the age of 12, the dosage is based on weight, so you could talk to your pediatrician to get the right dosage. Now, the reason it's generally safe to alternate these two medications is because they work differently to treat pain and fever. Tylenol is typically taken for headaches, joint pain, toothaches, fever. It's a type of drug that reduces pain signals within your nervous system, and it's processed through the liver. Now, when it comes to Advil, it's a non-steroidal anti-inflammatory drug, and it's typically taken for back pain, earaches, menstrual cramps, toothaches, and also to reduce fever. This type of drug actually blocks your body's production of prostaglandins that cause inflammation. It sounds like a good thing, but the thing that I found interesting that I read is that prostaglandins also protect the stomach. So you can see why it would irritate your stomach if you were to take these, especially on a long-term basis. And the Advil is processed through the kidneys. So how long would it be safe to alternate these two medications? Are there any risks? Are there some helpful tips to try to lower the risks? And is this something that would be safe for everyone to do? Well, we're going to talk about that shortly, but first I'd like to remind you to please like and subscribe if you're enjoying today's information. Also, a reminder to check out the links below. You'll see where I gathered the information for the video, and you also may see some product links or product suggestions. And also feel free to leave a comment below if you have something you'd like to share on this topic. That would be much appreciated. Okay, so how long would it be safe to alternate Tylenol and Advil? Well, it is safe. Typically, it's safe to do for longer than 3 days, but after 3 days, it's recommended to consult a physician. It's just a smart thing to do to be evaluated by a doctor if your pain or fever, haven't cleared up within 3 days. You could possibly have an infection, or you may need treatment for some kind of condition. You want to get that checked out. So what are some of the possible risks and side effects? When it comes to Tylenol, it could be headaches, nausea, vomiting, loss of appetite, and liver problems. When it comes to Advil, it could cause upset stomach, heartburn, nausea, diarrhea, vomiting, leg swelling, and kidney damage. So what are some tips to lower the risk? Some of these risks. Well, the best thing to do is to not take more than the recommended dosage for either one of these medications. I was actually really surprised when I read about Tylenol. I read that taking too much Tylenol is the most common cause of acute liver failure in the United States. And this actually can happen just after one large dose, or even after taking higher than the recommended dosage for several days. When it comes to Advil, it can irritate the stomach, so it's recommended to eat a little something with it, like some crackers, yogurt, a banana. It's actually recommended to do that with Tylenol as well, even though Tylenol doesn't normally irritate the stomach as much. Now, another tip would be to make sure you write down or keep track of some way just how often you're taking the medications and which ones you're taking, so you don't get them mixed up and you don't wind up taking one of the medications too soon or taking the same medication twice in a row. Also, when it comes to Tylenol, you want to make sure that if you're taking any cold medicine that you're calculating the acetaminophen that may be combined in the cold medicine. If you drink alcohol, you need to be extra cautious because when you try to take too much of either of these or a combination, it can be very bad for your liver. Now, would this alternating be safe for everyone? The answer is no. Some people would be at higher risk of taking one or both of these over-the-counter medications. For example, if you have certain medical conditions, it may be advisable to not really use these over-the-counter medications without consulting your physician first. If you have an allergy to aspirin, if you have asthma, if you've had a heart attack, if you have now or you have a history of heart disease, high blood pressure, kidney disease, liver disease, stomach ulcers or bleeding, and a history of stroke, that could cause more issues. If you're taking certain medications, they could also interact with either the Tylenol or the ibuprofen. Like if you're taking blood thinners, certain blood pressure medications, or corticosteroids, ibuprofen can actually interact with them in ways that increase bleeding risk or reduce the effectiveness of your other prescriptions. So in these situations, taking just acetaminophen alone would actually be the safest choice for pain and fever. So if you have some of these medical conditions, or you're taking some of the medications I just mentioned, it would be best to consult your physician before trying to alternate Tylenol and Advil. Now, if you don't have these issues, alternating Tylenol and Advil can actually be a very effective and safe way to control fever and pain on the short term. And that's just only if you make sure that you're using the correct or recommended dosage and spacing. Well, I hope you've enjoyed the information in today's video, and I hope to see you in the next video, where we'll talk about another way we can improve our health.